All right, Dr. Emer, we're live.
Hey guys, it's Dr. Emer, and we are in our procedure room today with our patient that has a bunch of little cellulite, and we're trying to get this improved with a new treatment called AVELI. We've shown you guys this online before, and I always tell people for cellulite, unfortunately, there's no treatment that gets 100%. There's always risk of getting bruising or discoloration in the area, so we do specific treatments to prevent that. But this helps to literally grab the band. You guys could see this little hook that goes, and it's going to grab the band and cut it. And so we've released some of these already up here, but through one incision, we're going to be able to go nice and slow, and you can see we're grabbing the band. And so we're just literally breaking apart the cellulite that's there. And our goal is to smoothen the look of the cellulite and her buttock, whether it's from aging, whether it's from a previous procedure, whether it's from just overall, it just can happen in women specifically more than men. Okay, you guys can see we're literally breaking it apart. And so what we do is we go right up to that band. Good. We grab it, we release it. It's really important that this can be done on any skin type. This can be done for only sort of dimples, and it improves the appearance much more than any treatment we've ever done before. You guys see, look, we're going back. We're verifying that we got those dimples. Okay, so even that top part's already done. So now we're going to work our way over to these side ones, and you see those here. A lot more difficult to treat. The fibrous septae over here are a little bit thicker. But all we need to do is just break those apart. And it's really cool because this light will tell us exactly where we are amongst the cellulite and then help us to guide us. Perfect. So those are all released. Let's see if there's any of those bands on here. You guys can see sometimes we get some of the cellulite bands. Otherwise, they just go under the skin. And you could see, look at the dimpling right here being pulled or just breaking it. And this hook really helps to smoothen the appearance of the cellulite and overall buttock. See here? There we go. Good, those are all released. So these are releasing pretty freely. My goal for her is to do some Morpheus or microneedling radiofrequency treatments, starting in a few weeks if possible, and doing radiofrequency as much as possible during the healing phase. Just repositioning here. You guys see we're grabbing all ends, so it's really important that when you do this, you don't just grab the dimple, grab the end of the dimple that we had marked. See? What are they saying? Nothing good? Mm-hmm. They're just all saying hi.
Yeah.
Yeah, it's actually not too bad of a procedure once the numbing is in. I know people get a little nervous because it's painful with the numbing.
How long does it take to see results?
You can see results pretty much instantly. I tell people at about 6 weeks is when we really can tell how it looks. I'm trying to do this as gentle as possible so we don't get that much bruising because we don't want pigment staining the least that we can. Perfect. And then the biggest issue area, sort of the lower buttock area. You just have to be really careful around here. So you don't want to drop the buttock. So we just really are careful with how much hooking we do. There we go. Good. Okay. I see we're grabbing that dimple and literally just breaking it. We're basically done on this side. We tell people compression for about a week, but they can be just underneath the clothes, very simple compression. And then they can be back at the gym in 72 hours. Okay, that's pretty much done on this side. Here's some of the fibrous septa right here. This is what we're releasing and cutting underneath the cellulite. So this whole area is done. I'm just gonna do a really quick
You're talking about how your thumbs must hurt.
check. That's okay. Just doing a check to make sure that they're fully released. And they pretty much are. Yep.
Let you
Perfect.
finish the other side off camera.
What? What?
Let you finish the other side off
Yeah,
camera.
so we're gonna finish the other side and you guys will see results in the next 6 to 12 weeks. That's AVELI, the newest treatment for cellulite. Okay, that side's done.
Doctor, can I ask